There are negative feedback mechanisms that regulate our energy intake, the food we bring in, and our energy expenditure. But we don't have sensory receptors that monitor our size or the weight. So, how's food intake regulated? Well, all we have right now is an incomplete answer. But over the past decade, we have made some important advances in understanding the regulation of food intake. So it depends on many factors we now know, including neural and endocrine signals, levels of certain nutrients in the blood. There are psychological elements such as stress or depression, signals from the gastrointestinal tract and the special senses, and neural connections between the hypothalamus and other parts of the brain. One of the hormones that helps to regulate food intake is leptin. So leptin helps to decrease total body fat mass. It's made and secreted by adipocytes, fat cells, when we store more triglycerides. More leptin is secreted into the bloodstream. So the leptin acts on the hypothalamus to inhibit circuits that stimulate eating, but also at the same time activates circuits that cause us to expend more energy. Another hormone that's regulated, or that helps to regulate food intake, is called ghrelin, and it's produced by endocrine cells in the stomach. And ghrelin plays a role in increasing appetite and therefore stimulating us to intake more food. In addition to just eating for the energy and for metabolism, think about all the things and all the roles that eating plays in your life. Psychological, social, cultural. If we're having a birthday party, we eat. There are people that withhold food as punishment. If you're feeling bad, someone cooks you a casserole. Someone tells you you shouldn't eat something, so you do. Psychological, social, cultural. So eating in response to these emotional drives, such as when you're feeling stressed or bored or tired, is called emotional eating, and it's very, very common and even considered normal behavior as long as it's controlled. I mean, all of us have come in from work after a long day and head to the refrigerator and pull out that pie, or stop by and picked up a hamburger and onion rings and a chocolate shake on the way home. Well, that's normal, but problems arise when emotional eating becomes very excessive and it interferes with your health. Physical health problems include obesity and associated disorders that come along with obesity, such as hypertension and heart disease. Psychological health problems also play a role in emotional eating and can result from emotional eating, such as poor self-esteem or an inability to cope effectively with feelings of stress, and even in extreme situations, eating disorders such as anorexia, bulimia, and obesity. Eating provides comfort, helps to numb pain, and we feed the hungry heart. But eating also can provide a biochemical fix. Emotional eaters typically overeat carbohydrates, such as sweets and starches, and that can raise brain serotonin levels and help us to feel more relaxed. Food has very often become a way to self-medicate when we just don't feel well about something, and we have that feeling, that desire for comfort, and food often provides that. So let's look at some of these disorders, and we'll begin with anorexia nervosa, and it's a chronic disorder that's characterized by self-induced weight loss, also accompanied by a negative perception of body image and psychological changes that result from depletion of nutrients. Patients with anorexia usually have a fixation on weight control, and they often insist on having a bowel movement every day, which not everyone does, even though they may not have adequate food intake. They often use laxatives or stool softeners, which can worsen the fluid and electrolyte imbalances and nutrient deficiencies that they're suffering because of the condition. It's found predominantly in young single females. There is some research that shows that a predisposition for anorexia may be inherited, abnormal patterns of menstruation, including amenorrhea or stopping of the menses, a low basal metabolic rate, can reflect the depressant effects of starvation. So individuals may become very emaciated and ultimately die of starvation or one of its complications. Also associated with anorexia are osteoporosis, depression, brain abnormalities coupled with impaired mental performance. Treatment typically consists of psychotherapy and dietary regulation. Bulimia is known as the Binge Purge syndrome. So it's a disorder that typically affects young, single, middle-class white females most often. And it's characterized by overeating followed by purging or self-induced vomiting. Sometimes very strict dieting or fasting, vigorous exercise, the use of laxatives and diuretics. It occurs in response to fears of being overweight or in response to stress, depression, and psychological disorders and physiological disorders such as hypothalamic tumors. Obesity is a body weight more than 20% above what is considered the standard, and it's due to an excessive amount of adipose tissue. More than 1/3 of the adult population in the United States is considered obese. Now, let's point out, however, an athlete may be overweight due to a higher than normal amounts of muscle tissue without being obese. So many bodybuilders and weightlifters that have extreme muscle mass are over desired accepted weight, but not obese. Remember, obese is 20% or more excess adipose tissue. All right, so even moderate obesity can be hazardous to your health as it increases cardiovascular disease, hypertension, pulmonary disease, non-insulin dependent diabetes mellitus type 2, arthritis, and even certain cancers such as breast and uterus and colon cancer. It increases the incidence of varicose veins and gallbladder diseases. Most cases of obesity have no specific underlying health cause. However, contributing factors can include genetic factors, eating habits that you're taught early in life, overeating to relieve tension, or social customs. Most excess calories in the diet are going to be converted to triglycerides and stored in adipose cells. At the beginning, the adipose cells increase in size, but once they reach their maximal size, they can divide, and as a result, proliferation of adipocytes occurs in extreme obesity. Treatment of obesity is very difficult because most people who are successful at losing weight tend to gain it back within 2 years, but even moderate weight loss increases health benefits. So some of the more common treatments include behavioral modification programs, very low calorie restrictive diets, some drugs to decrease appetite, and then there are surgical alternatives as well.